Hello and welcome to the Oral Health Podcast. We've got a little bit more of a serious topic on the docket to discuss today, just because we are talking about the price change in NHS dental charges for England and Wales, because they are going up, and it's caused quite a stir. Being the Oral Health Foundation, we have our duty, as it were, to just talk about what's going on, what the price change actually means for people. And for the first time in a long time, the prices in Wales are actually rising. So, Karen, obviously, you do a lot in the dental news and dental press, so you know about this. So let's just see what's going on.
Well, normally the prices go up the 1st of April every year. We had a bit of a blip where it didn't go up during lockdown, but it did. We did have a price rise last year. So England has had one every year. Wales got a little bit behind, so they had a price rise last year, I believe. So theirs hasn't caught up with England yet. Just have to remember that Scotland and Northern Ireland are on a different scheme. They don't do the band system, so they're on per item of treatment. So all the bands the charges are going up by 4% in England as of the 1st of April. So that's for everybody who starts their course of treatment 1st of April or afterwards. If you've already started your course of treatment, you will be paying the old charges as of the 1st of April. If you have a checkup on that day, going forward you'll pay the higher one. So currently band 1 is £25.80, so that's your checkup, any necessary x-rays, it's any necessary cleaning and preventative advice. So that will be going up to £26.80 on the 1st of April. So that's a pound rise. So we'll probably not notice that.
Overall, I guess, no,
overall.
But in the big system, I guess it makes quite a difference.
Well, yes, yeah, and I'd say that's 4%.
Yeah.
So band 2 is the more complex treatment, so fillings, root fillings, extractions, deep cleaning, so deep gum treatments, that kind of thing. But it includes everything in the band 1 charge as well. So your checkup, so you're just sort of going up a tier. So that currently is £70.70, and that will be going up to £73.50. So that's your 4% rise on that one. Then we look at band 3. Band 3 is anything that involves laboratory work. So crowns, dentures, inlays, onlays, mouth guards, night guards, those kind of things. But that again includes anything in band 2 or band 1. So that is currently £306.80. And as of the 1st of April, it will be going up to £319.10. So obviously that's the biggest hike because it's a higher figure we're starting at.
Yeah.
Now, your urgent or emergency treatment, so that is an appointment that you phone up because you've got an urgent or an emergency, dental emergency. So that's any appointment in between your regular checkup carries a charge. So currently it's £25.80. As of 1st of April, it will be going up to £26.80. So it's the same price as a band 1 charge, but not to be confused with a band 1. It is a standalone charge.
It just happens to be the same price.
It just happens to be the same price.
Okay.
Yes, so that is something to look out for. Now let's go on to Wales. So Wales has had, it's not a blanket 1%, as in England, like with 4%. So the percentage rise is variable. So band 1, so that's your checkup, as we said before, is £14.70 currently. That will be going up to £20 on the 1st of April. So it's a jump. That there are different, some people get free checkups. So we can add on the link to this so that you
As
can
in,
go
like
onto it.
the price exemptions, like pregnant women.
Yeah,
and,
but also
job seekers, that kind
yeah,
of thing.
those are benefit ones, so that would be anybody would be exempt, but there is people over 65, I think, get free checkup
Oh, okay.
in Wales, but have to double check that because I think whether that's changed. I don't think that's changed.
Okay. And what about the other bands?
The other bands are the band 2 is £47 currently, so obviously significantly less than in England, and that is going up to £60, so it's still cheaper than the price in England. So that's gone up again. So as you can see, the price rises in Wales are a higher percentage. They're between 27% to over 50% on some of the particular bands. So currently at band 3 is £203. That is going up to £260.10. So again,
A huge
a hike.
rise. Yeah.
Yeah. I think they're trying to bring it more in line to the English one, but you couldn't jump from what it is to the same one as in England. Now, urgent or emergency treatment, obviously this is the band, the standalone band, has had the biggest price rise. So that's over 50% price rise on that one. So that before you would be paying £14.70. After April the 1st, you'll be paying £30 for that.
So it's nearly doubled. In fact, it's over doubled, hasn't it?
It's over doubled, yes. It's over 50% more. So, yeah, that's the biggest price hike there, and actually takes it to a few pounds more than you pay in England for the.
And that's the one occasion where that's the case.
Yeah.
How strange that even the jump has been huge, but it's still cheaper to go to an NHS dentist in Wales overall than it would be to go to England.
That's correct.
So say if you lived in somewhere like Cheshire, could you just register at one over the border and then that would be cheaper?
Yeah.
It's
Shropshire,
not
probably a little bit nearer as well. Yeah, you can go over the border. It's like if you have a doctor in Wales, you don't pay prescriptions. There's no prescription charge. So those are the rises. Again, the exemptions haven't changed. So, I mean, there are various reasons for exemption. Under 18, 19 if you're in full-time education, a pregnant woman, and you're exempt up to the baby's first birthday. Benefits, most people it's universal credit these days, which encompasses a lot of the different ones. Pension credit, it has to be the guarantee credit portion, and name on a NHS tax exemption. So those are the automatic exemptions. Housing benefit, blah blah blah, all of those don't get it automatically. Not to say that you wouldn't get it, but it's not an automatic. So if you are on a different benefit or you're on a low income, you can apply for help towards your NHS costs. So that is not just dental costs, that's opticians, wigs, all the other things that you would pay towards on the NHS.
the HS2, HC2.
HC2, is what you would be awarded. Now,
HS2 is the train. It's not that one.
No, that's where they're digging up all around us, aren't they?
Well, let's not get on that topic.
Let's not go to that.
We will be here for a long time.
Yeah, so if you want to see if you are entitled to help towards, you would need to fill in a HC1. You can do it online. You can get the actual paper copy from many dentists will have them, or a Job Centre Plus you can get one from. It's a bit of a laborious form. All your incomings, outgoings, etc., etc.
Oh, it takes an age to complete.
Really does. Well, it does if you get it.
Yeah.
So what they might do, they might offer you either full exemption, partial exemption, so you have to pay up to a certain amount, or they say no.
No, sorry.
It does go on savings as well, so if you've got over a certain amount of savings, you won't be awarded it.
Well, that's the same as most benefits.
It is. It is. It's all sort of that sort of savings accounted into it. But we'll again put on the website where you can go and have a look and apply for it.
Now, NHS dentistry is such a sour topic at the moment in our office because we are all dentally minded, but then also out and about in the wider press. There's a lot of people saying that they really struggle to find an NHS dentist, and we're not going to get into that topic today, but it is something worth having a discussion about. Specifically though with the charges, what do we feel about the charges? It's such a tricky topic that...
Yeah, it is. And it is still subsidised. That's what we have to remember. So when we go to the dentist, the government, the NHS, is still subsidising that. So whatever the patient's contribution is not how much it costs to do your treatment. Your treatment will cost a lot more than that. It's just the extra bit the dentist claims from the NHS. However, in this sort of band system that we have, there are some things that patients will find particularly unfair. So, for example, if you go in and you need one filling, it will cost the same as if you go in and need 7 fillings.
Yeah,
it's
or a
one
mouthful of
charge.
fillings. Yeah, because it's all the same treatment.
It is indeed. So it's the same if you go in and you need a denture that has one tooth on it, or you need full upper and lower dentures. It's the same charge. So from that respect, it can be unfair on more on the people that look after their teeth than the people that need a lot of treatment. So that's some of the reasons why somebody might not go to the dentist very often, because they think it's going to cost a lot.
Yeah.
And we have got cost of living crisis. We've got people that are working full time still having to use food banks. So even just a few pounds added on, it's going to be something that is that somebody's going to have to think about. Do I go to the dentist, or do I use the money for something else that is more needed
more urgent
than
in the moment,
exactly. So yeah, I mean, no price rise is welcomed. However, as we know, NHS dentistry is underfunded, so the more money that they can recoup from the patient,
the more funding goes into helping more people with the system. Yeah.
Theoretically, I'm not sure that it's ring fenced for dental. I don't know what the Treasury do in regards to that, but yes, I mean, as I say, a price rise is never welcomed. However, in some cases, it's necessary to keep a service going, and we know that the service is in big trouble. But we have to fight for it.
Yeah.
We have to fight to keep it.
We really do. And as just as a little aside, we have to remember as well that for the vast majority of the time, dental disease is preventable. Yeah. So you can prevent yourself needing 7 fillings, or you can stop that by just managing it before you have problems.
Yeah.
I think we're quite bad at preventative care in our... We don't tend to think, I'm going to book a doctor's appointment in 6 months just to see that I'm all okay. Like, we don't. That's
dentistry
not how we work.
Is the only thing that we go when we're not ill.
Yeah.
So if you have a good oral hygiene routine, you have a reasonable diet, your oral health is pretty good, you really probably will only need to see your dentist once a year, which then makes the £26.80 or the lower charge in Wales much more appealing, because you'll be paying that once a year. So broken down over 12 months, it sounds much better.
Yeah, absolutely.
So if we can work on that premise that we're working towards being dentally fit, we're working towards having good oral health, and we go once a year, that is the ideal.
Absolutely.
We still need to go once a year, even though if we've got perfect health. There's nothing better than, your dentist saying to you, no, absolutely fine, everything's fine. But then you know that you've had the checks for the other things that can go on in the mouth that we don't have any control over. such as mouth cancer,
Yeah.
that can only be picked up if you go to the dentist. And that's for people who have no teeth at all as well. You know, they'll say, oh, I don't need to go, I haven't got any teeth. We're not just
Still
looking
got a
at your
mouth,
teeth.
yeah.
Exactly. So, yeah, I mean, I think those are the ways that the best way to look at it is if we focus more on prevention, the less treatment we need, the less it'll cost us.
Okay. I think that's a really hopeful note to end on on a topic which does not garnish much hope when you just look at the headlines, but actually, yeah, digging a bit deeper, it is what it is, and you know, in the long run, if we can look after our mouths, then we don't need to worry so much about it.
Totally.
We'll be back next time talking about something a little bit more uplifting. You'll be happy to hear, I'm sure. We've got some guests on from Recipe for Change to talk about the upcoming anniversary of the soft drinks levy, and it was really interesting discussion, which I think Karen would agree with as well.
I would, yeah. It was really, really good to see a different side of something that we bang on about sugar, and coming at it from a different angle, but all agreeing at the end. It was nice.
It felt really productive. It was great, yeah.
Yeah, we felt like grown-ups, didn't we?
I really did. I was out of my depth a little bit, but it's all right. But
I was there to hold your hand.
You were a little bit.
Metaphorically.
But, you know, we'll be back to hear from Kate and Catherine next week. So I hope you will come back. And thank you for listening to us today.